Welcome back to Trinidad and Tobago and happy International Women's Day. Well, we will be having our second Tobago segment at this time. We are joined by Dr. Diaz Gomez, Specialist Medical Officer, Nephrologist, TRHA. Good morning and welcome. Dr. Diaz Gomez.
Good morning.
Good morning. How are you doing?
I'm fine.
All right, so we're talking about World Kidney Day 2018?
Yes.
Okay, when exactly is World Kidney Day?
Okay, before to start it, I'd like to say good morning to Trinidad and Tobago, and I'd like to say a happy International Kidney Day and happy International Women's Day.
Thank you so much. When is World Kidney Day 2018?
World Kidney Day. World Kidney Day is today, the 8th of March.
Okay. It is today, you said?
Yes, it is today.
Okay,
Yes,
wow. So we are celebrating World Kidney Day as well as International Women's Day.
That is correct.
All right.
Yes.
So one of okay, so we're talking about the kidney, and just to start, we'd like to highlight some of the functions of the kidney. Could you walk us through some of the important functions of the kidney?
Okay, the kidney is one of the most important organs that we have in the body. We call the filter in our body. And this is the first function, filter the blood and the water that we have in the body. In the meantime, the kidney control the calcium and phosphorus metabolism, control all the electrolytes that we have in the body. When they say electrolytes, I say sodium, potassium, magnesium. Okay, and the kidney control the blood pressure in our body.
All right. And Dr. Edobor, what are some of the causes of kidney diseases and what are some of the diseases?
Okay, so internationally and in Trinidad and Tobago, diabetes and hypertension are the leading causes of chronic kidney disease. Other causes will include lupus, patients who have kidney stones as well.
Okay, and what can be done, first of all, to prevent kidney diseases? What sort of lifestyles should we be leading?
Okay, so because the leading causes are diabetes and hypertension, we know that our diet, exercise, and our bad habits contribute to these diseases and to worsening health. So you need to eat healthy, exercise, do not smoke, moderate intake of alcohol. You need to see your doctor regularly, either once a year, twice a year, and you need to take your medication as prescribed.
And upon realizing that you may have some sort of kidney disease, what are the next steps as a patient?
Okay, so once a patient is diagnosed with kidney disease, they're referred to a nephrologist, just like Dr. Gomez here. And his role is to control all the conditions that can worsen the kidney problems.
Okay, and what are some of those conditions that can worsen the kidney problems?
Okay, we need to control diabetes and hypertension. We say that diabetes and hypertension is the leading causes in our patient. If we control diabetes or hypertension, we control more than 90% of our causes.
Okay. And renal replacement therapy, what exactly is this?
So renal replacement therapy are procedures that we embark on when a patient kidney fails. So you may have heard of dialysis.
Yes.
So there are two types. So there's hemodialysis, where we take the blood out of your body, purify it in a machine, and return it to you. Then there's peritoneal dialysis, where we put a catheter inside the front of your abdomen, run fluid in, it stays there for a while, removes all the impurities, and the fluid leaves your body. And the final type of renal replacement therapy is kidney transplants.
Okay. And how would you describe life with kidney disease? How much easier can it be in terms of receiving treatment, for instance? Can you lead a normal life?
Yes, you definitely can lead a normal life. Patients with chronic kidney disease, you just take your medication, maintain your conditions, and you continue to live a normal life. even if you are on renal replacement therapy, hemodialysis takes 3 to 4 hours, 3 times a week, and peritoneal dialysis is every day. However, most patients do it at night while they sleep.
Okay, I'm not too sure if you mentioned dialysis, the two types. Is it hemodialysis and peritoneal dialysis?
Peritoneal dialysis.
All right. What are the differences?
So, as before, hemodialysis is purifying the blood directly. So remove the blood, purify it in a machine, and return it to your body. In peritoneal dialysis, it's a tube through the front of your stomach. You put fluid in, and fluid runs out after.
And how costly are these procedures?
Normally, this procedure, the cost is between 100 to 120 US per session.
Okay.
And the patient needs 12 sessions per month.
Right. And in terms of awareness, are people coming out on an annual basis to get their regular checkups? Or is it that we wait too late when we realize that something is wrong?
We recommend it, for this situation that any patient that feeling any symptom or not feeling any symptom, go to the health center to check in at least every 6 months.
All right. What are your closing comments, Dr. Edobor?
Okay, so chronic kidney disease, this is International Women's Day. And chronic kidney disease affects more than 195 million women worldwide. So please take care of yourselves. We need you to be around for our children.
All right. And your closing comments,
Okay,
Dr. Diaz-Gomez?
Yes, I can say that here in Tobago, we have a team in Scarborough General Hospital, in Scarborough Health Center. We work in the community. Any question that any advance that the patient needs, we open for that.
All right. Thank you so much for being part of our show, sharing so much on kidney disease this morning. It's a pleasure having you all on. Very informative indeed.